Hi and welcome to Med for Care. I am Dr. Care and today's topic will be red urine. Let's find out together what it is. The red urine represents an atypical coloration of the urine, which, under physiological conditions, appear yellow or amber yellow, resulting even transparent when the state of hydration is optimal. The finding of a red, pink, or reddish color in the urine may result from the presence of microscopic traces of blood inside the meato, or microhematuria, or from the presence of blood vessel to the naked eye, defined as macrohematuria. It should be remembered that not in all cases it is the blood that is responsible for this unusual coloration of the urine. In various transient situations, in fact, various foods and drugs can give the urine a reddish color. Well, let's see together now the causes that may be at the basis of the reddish color of the urine. Hematuria can be frankly visible to the naked eye in the urine emitted into the toilet, and this can be defined as macrohematuria, or can only be measured after microscopic observation in the laboratory, and therefore we will speak of microhematuria. Regardless of the visible or microscopic manifestation, hematuria is often a recurring sign in various infections of the urinary tract, such as pyelonephritis or acute cystitis. Hematuria can also result from pathological conditions not necessarily associated with infectious or neoplastic pictures. A frequent case is when the formation of stones occurs in the kidney or in the urinary tract. The latter can cause an obstruction to the passage of urine and consequent spasms of the ureter or urethra, which, by compressing, generate the passage of blood in urine. Another cause that can give rise to reddish urine is myoglobinuria. This phenomenon represents the emission of myoglobin inside the urine and can result from repeated traumatic insults to the muscle bundles, from dissecting lesions of the muscle, or from toxic states of the organism. Myoglobin is in fact a structural protein that is localized in muscle cells and is poured into the circulation and then into the urine following injury to the muscle. Hemoglobinuria represents the presence of hemoglobin inside the urine. Hemoglobin is a structural protein that ensures the transport of oxygen in the blood and is stored in red blood cells. Therefore, following states of hemolytic anemia or red blood cell diseases, the erythrocytes break down, pouring out the hemoglobin. As we have seen before, foods can also be responsible for the reddish color of the urine, specifically beetroot, a herbaceous plant exploited for cultivation in the vegetable garden or for the production of sugar, can cause this effect, as well as two fruits derived from plants' shrubs such as blackberries and blueberries. Well, now we will focus on the diagnostic evaluation of the urine, that is, examinations and specialist visits that allow us to understand the origin of the reddish color of the urine. The urological examination allows the specialist doctor to better investigate the causes that led to the reddish coloration of the urine, mainly by resorting to the anamnesis. Through the anamnesis phase, the doctor is in fact informed about possible drugs or foods taken, possibly responsible for the red urine, or about symptoms that may lead to believe a history of infection or stones of the urinary tract is likely. After the anamnestic phase, the doctor continues with a physical examination of the patient, concentrating mostly on the inspection and palpation of the lower half of the abdomen and in the hypogastric region, looking for painful points or swelling. Any swelling could suggest acute retention of urine in the bladder, a neoplasm, or a benign mass compressing the urinary tract. Any other laboratory or instrumental tests, such as chemical, physical, and microscopic examination of the urinary tract or ultrasound of the urinary tract, could provide a valuable aid in the targeted search for the cause of red urine. Red-colored urine, as seen, is often caused by harmless and non-pathological factors, such as the intake of foods like blackberries or antibiotic or pain-relieving drugs. In such cases, no special therapies are required as the phenomenon is benign in nature and tends to resolve spontaneously. When, on the other hand, the upstream cause is represented by more serious conditions such as macrohematuria or acute porphyria, that the management of the patient becomes etiological and symptomatic, for example, aimed at treating the pathological causes and symptoms of the patient themselves. In the case of hematuria, for example, since this is often caused by urinary tract infections, it may be necessary to administer specific antibiotics for a few days. In the case of acute porphyria attacks, the therapy becomes much more complex and involves the elimination of the drivers of the acute event and the administration of glucose and biological drugs. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon in Med4Care.